Hello, my name is Joe Ebner. I am the Chief Medical Officer at Speare Memorial Hospital in Plymouth, New Hampshire. I want to welcome you again today to this COVID-19 update. Today's date is Thursday, March 26, 2020. It's important that I mention that date because what we talk about today is likely to change in the days, weeks, and months to come. So I want to remind you that the most up-to-date information can be found at various websites maintained by Speare Memorial Hospital or Midstate Health Center, which will direct you to the CDC website for the most accurate and up-to-date information about COVID-19 period. This address is mainly targeted to the greater Plymouth community and the people living in our community in central New Hampshire. I first want to say thank you. Thank you for your social distancing and isolation efforts. It is important that you understand that this is the largest public health move that we could make to save hundreds of lives in our community in the months to come. I will address more on this later in this bulletin. In my first announcement last week, I addressed ways to maintain and improve your physical and mental resilience during this difficult time. I will ask that you consider, if you are able, to support local businesses by considering ordering takeout food to bring home to your family, to look forward to that as a treat, and also support local businesses. I understand that this period of isolation and distancing has led to financial hardship for many of you. I want to draw your attention to the website at the bottom of the screen, www.neasy.nh.gov. If you feel that you are in need of assistance, the state of New Hampshire has made an easy way to get that assistance. And now for a COVID-19 update. In the state of New Hampshire, as of last night, we have confirmed 137 cases. Most of these have not been hospitalized. We do identify community spread. In Plymouth, we have identified 2 positive patients. Both of these were related to travel. I have been asked, what do we expect? I have to tell you that the predictive modeling is challenging, but does provide a ballpark for our planning purposes. We expect in the months to come, nearly 1,000 patients with COVID will need some kind of hospitalization. If they all arrived in the next week or month, this would clearly not only overwhelm Speare Memorial, but also the healthcare resources of the state of New Hampshire and the region. But if we could space out these 1,000 local friends and family over a 4-month period, we would expect Plymouth to have about 100 to 200 hospitalizations a week, and that is what we are preparing for. And this is why it is so important that we continue the social distancing and isolation efforts that you've already undertaken. This will help flatten that curve so that those sickest patients come in a scattered period over the next 4 months so that we have the resources for them. What has been our response and what is our planning right now? At the current time, we have an emergency room triage tent even before you get to our emergency room. This will separate those with respiratory illness from other people seeking emergency care. Within our emergency room, half of it is divided for respiratory illness and the other for non-respiratory. This concept continues upstairs to the floor and in the ICU, where we will continue to separate those with respiratory illness, whether confirmed COVID or suspected, from other medical patients requiring hospitalization. Speare is also working to expand its capacity. Currently, we're a 25-bed hospital, meaning we can care for up to 25 patients at a time. We are putting into place now plans that will allow us to safely care for patients to over 40 at a time. For our patients out there who are expecting, please know that we are making every effort to keep labor and delivery a COVID-free zone for the health and safety of our pregnant patients and their newborns. Even if Speare is able to increase its capacity to over 40 beds, we will have additional need. As of this morning, through our Public Health Emergency Preparedness Coordinator, Mid-State Health Center, Speare Memorial Hospital, our first responders from a couple of towns, the university, as well as the New Hampshire National Guard, are working to create an alternative care site at the Plymouth State Welcome Center and Ice Arena. This area will be able to medically treat up to 100 additional COVID patients who were either too sick to be returned home, but not quite need the higher level of acuity which will remain at Speare Hospital. I want to thank all of those partners that I mentioned, helping to make that alternative care site a reality. Let me review the symptoms that you might be experiencing. If you're feeling mildly ill, we recommend that you stay home and call your physician. If you are feeling severely ill and need to be seen, please call your doctor first. They will help triage over the phone suggestions and what to do. If you feel your health is in danger and that it's an emergency because of shortness of breath or labored breathing, please come to the emergency room anytime. Some of you might be wondering, why can't I be tested for the COVID-19 virus? This is a reasonable request, especially if you're being asked to stay from work and you want to be cleared to work quicker. Currently, because of the lack of testing kits and resources, we do not have the ability to test everybody. Around the state and around the country, labs are working to increase that capacity, so this could be a different recommendation by next week. But at the current time, testing is restricted to healthcare workers and their families, to the sickest hospitalized patients, and to residents and visitors of long-term care facilities. Whether you have COVID or not, for your symptoms, if they're mild, it will not change the recommendation. The recommendation continues to self-isolate at home for at least 7 days from your symptom onset and at least 3 days of recovery from your respiratory illness and fever. All symptomatic, close contacts of a person suspected of COVID should stay at home for 14 days from that day of last exposure. As I mentioned earlier, the most accurate information can be found on Mid-State Health Center and Speare Memorial Hospital websites and the CDC. Speare continues to maintain a helpline at 603-238-6464 if you have the need to speak to somebody about your symptoms. Many have asked in our community, how can we help? It is not surprising that all hospitals are looking at potential shortages of PPE, personal protective equipment, to keep our healthcare workers safe. Specifically, face shields and masks seem to be in short supply. There's an email at the bottom of the screen, COVID-19 donations at spearehospital.com. If you feel you have the ability to donate supplies that could be useful, please send us an email and we'll be in touch. There will likely be a time when we need volunteers as well to help with the influx of sick patients. At a later date, we will provide information for how you might be able to help in this crisis. In closing, please know that your healthcare system, along with support from the state and the National Guard, is working to keep you, our community, safe. We understand the hardship this has caused many of you and appreciate all that you're doing to help keep our community safe. I know that our community is one that helps each other, and I trust we will continue to do that in the weeks and months to come. For now, remain calm and healthy.